A 39-week pregnant woman presented to the maternity ward. After 12 hours of labor, it was decided that a C-section would be performed and an epidural was placed. After the patient was in the recovery room, vitals began to change. A change in blood pressure was noted, oxygen saturation was decreased, respirations were rapid, and a fever of 106.9 degrees was noted, the hallmark sign of a malignant hyperthermia crisis. This is a true case study that was published in the June 4th, 2015 issue of the Journal of Obstetrics, Gynecology, and Neonatal Nursing by Amy Dogstead and Melanie Herman, both RNs. This patient lived because the staff was prepared to treat a malignant hyperthermia crisis. Proper treatment was initiated and dantrolene was administered. However, 2 years before this incident, it was noted by the facility's accreditation source that the facility had no protocol for MH and no medications there to treat it. If this patient would have presented to this same healthcare facility 2 years prior, they would have died. Because malignant hyperthermia is rare, healthcare workers are frequently unprepared to treat an MH crisis. This leads to devastating patient outcomes and often death. According to statistics from the Malignant Hyperthermia Association of the United States, 1 in 100,000 patients, adult population, will endure a malignant hyperthermia crisis. 1 in 30,000 pediatrics will also endure a malignant hyperthermia crisis. 1 in 2,000 people carry the genetic component that predisposes them to MH. MH is higher in certain geographical areas. Wisconsin, Virginia, West Virginia, Nebraska, and Michigan. Therefore, it is vital that facility educators provide their healthcare workers with the knowledge and training necessary to provide efficient and effective care for an MH crisis. In the March edition of OR Nurse 2013, L. Woosley argues that each facility should be stocked with 36 vials of dantrolene and an MH cart be prepared and accessible. Woosley states, and I quote, "Annually, the facility should review the MH cart, supply location, and steps involved in managing an MH crisis. Staff should review the MH protocol and practice mixing dantrolene by using the expired product." In February 2014 issue of AORN Journal, Cindy Kane RN, Mathis Rice MD, Lynn Geihorst RN, and Judah Novolgia MD argued that education through simulation better prepared their staff when encountered with an MH crisis. As claimed by these authors, and I quote, "Nurses and surgical technologists expressed that training increased their knowledge and confidence in relation to the roles and responsibilities that are required in an MH event." If facility educators fail to provide the knowledge and training needed to respond appropriately to an MH event, signs and symptoms may be missed or not acknowledged at all. There are more elective surgeries now than ever before. This means that healthcare providers are more likely to encounter an MH crisis in their lifetime. This is huge, and we must be prepared. Talk with your facility educators regarding the protocol for MH education at your facility. If you have questions, ask. Familiarize yourself with the MH cart and know how to mix and administer dantrolene. Mock codes and yearly education are essential according to the Malignant Hyperthermia Association of the United States. Remember, knowledge and training will empower healthcare workers to respond efficiently and effectively to an MH crisis. Thank you. This is Shannon Burr, Core 210.